My next guest is here to tackle a serious topic, the dramatic rise in abuse of prescription drugs. In fact, it's not just considered a problem, it's an epidemic. And while many law enforcement agencies are working to get a handle on the availability of these types of drugs on our streets, my next guest is working to help those who are addicted. Joining me now, Ed O'Reilly, the director of the Neil Kennedy Recovery Clinic in Dublin. It's nice to have you here, Ed.
Nice to be here, Gail.
A scary topic, actually, and one that apparently is caught the attention of law enforcement, but if you're in the addiction business, you've probably seen this for a while now.
Yes, it has been increasingly accelerating, though, in the past few years. If you had told me as recently as 5 years ago it would get this bad, I would have been a little surprised.
Is it mostly from folks, and we're talking prescription drugs, mostly painkillers?
It's mostly painkillers, although also involved are the anti-anxiety drugs like Librium, Valium, and Xanax. People also develop problems with those, and in particular, if they take those together with the painkillers, it's a potentially lethal combination.
Mm-hmm. Are we talking about people who start legitimately on these prescription drugs and it leads to addiction, or not so much?
Some do.
Mm-hmm.
It have legitimate chronic pain issues. However, a lot of people, especially the younger folks, are starting on them as, in essence, party drugs.
Really?
Yes. Kids will have, teenagers.
Mm-hmm.
That's one
kids
of the,
to us, yeah.
Yes. Will have, even now these days, have pill parties where they just dump assorted pills in, and they aren't normally quite sure what they're getting, and occasionally there's some pretty unfortunate, results out of that, because some of it is quite potent, quite powerful medication.
So initially, where are they getting them? From a home medicine cabinet?
Unfortunately, yes.
Really? Yeah.
Yeah. A very common place that people get these is, say, I sprain my knee, and I go to the doctor and I get a little prescription for a painkiller. Nobody seems to get rid of them after there's some left over. We tend to put them in the back of the closet.
Just in case.
Yes. Mm-hmm. And that's where they get them.
You specialize in addiction of these prescription drugs, although at your center, it's all sorts of addiction that you deal with as well.
Indeed, yes. The good old standby alcohol is still an issue.
Mm-hmm. Mm-hmm.
And in this context, the combination of alcohol and prescription painkillers is another one of those potentially lethal combinations people don't pay much attention to.
If a family member's watching this and they have suspicions that either a friend or family member is addicted, what should be their first steps, Ed?
It's a little different depending on whether it's themselves or a family member. If I think I might have a problem, the chances are pretty good I probably do.
Yeah.
And I would strongly recommend give somebody a call. There are plenty of fine upstanding programs here in Central Ohio. Ours is one. That will be able to help people out. If it's a family member, it's a little different. Obviously, do talk with them about it. However, don't be prepared for a positive reaction.
I'm sure.
Because very oftentimes you'll
Denial's big, isn't it?
Exactly. You have got it there. And so you do talk with them about it, but after that, take care of yourself. Mm-hmm. Because it's very anxiety-provoking being in a relationship with somebody who might have a drug problem. So there's Al-Anon, there's Nar-Anon, there's companion organizations for people who are in relationships with people who have a possible addiction issue.
Very important point. Is there ever a time when a dentist or a doctor themselves will have a suspicion about a patient and then reach out to someone like you?
They might. What happens is that dentists probably not.
Okay.
Because you don't develop a problem with what's called acute use, which is a one-time thing because you had a root canal.
Right.
Okay. You have to take it for a while. You can't get addicted instantly. Mm-hmm. Okay. Now, if you are getting, say, pain medication from a doctor, they might notice over time, but normally only when things are getting pretty far along, because when you start calling to refill prescriptions ahead of time, when you keep telling them you lose them, then they start paying attention. By that time, you're probably already developed a decent problem.
And you treat all ages, which is sad, but you talked about teens and kids, and it can start that young.
It can. The issue with teenagers is it takes hold faster. Okay, and so it's a much more accelerated process. So you can end up with kids who are addicted and they're 15.
We have your number and your information on screen, so hopefully if someone out there feels that they have a problem themselves or knows someone that does, that at least they'll reach out and try to get some advice from you. That's the first step, isn't it?
Yes, it is. Absolutely.
You can't get help unless you ask for it.
That is very true.
Ed, thank you so much. Nice to have you here.
Thank you. Nice to be here.
Coming up next, we all know that the outdoors are fun to enjoy the snow that we've had this season. We'll show you a little fun, and stick around to hear today's word of the day. It may just help you win $200. Don't go away.